And the agenda for tonight is to do an introduction. I'm going to do a quick introduction of all our panelists, and then I'm going to ask each one of you panelists to do a 3 or 4 minute discussion of who you are in particular. It looks like we lost Chaplain Davies.
Oh, no, I'm still here.
Oh, wonderful. Okay. Okay, so I'm going to ask you panelists to make your remarks. Then after about 12 minutes, we'll start the moderated session. Then there will be a period of questions. I reserved about 30 minutes for questions, and then there'll be some final comments from you guys and some final takeaways. So welcome everyone to this presentation. The title we've already talked about, the format we covered. So now I want to talk about who I have as panelists. But first, let me say this. I was sharing with Chaplain Davies that this was a difficult process to do. Had I known that it would be this difficult, I would have picked an easier project for my DMin degree. But having said that, I am so thankful because despite all the hurdles and all the burdens that we had to carry, I can't think of a better panel to have brought together than you guys tonight. I was sitting down, I wrote a paper over the weekend for the DMin degree, and I talked about each one of you. Dr. Davies is, or rather Chaplain Davies is the spiritual director at Robert Wood Johnson Hospital. Grace is at Bella Vista. I'm going to try, if I mess up your name, Chaplain, please correct me, but Chaplain Cuenca is
Cuenca?
Say it again?
Cuenca.
Cuenca, okay. Is at ICPT, Institute for Clinical Pastoral Training. And Dr. Wright is, he corrected me once tonight, but I'm going to make the same mistake again. He is the director of CPE at Liberty University. He also happens to be, I think, when I did some research, a chaplain at a Veterans Administration hospital. So we have a wonderful panel tonight. I'm going to ask each one of you, if you would, to talk a little bit about yourselves, and I'll ask Chaplain Davies to begin.
Sure. So when you asked me to be on the panel, I had to say yes for 2 reasons. One is I love Puerto Rico. The second is I also love DMin students. I'm also a professor for our DMin program at New Brunswick Theological Seminary in New Jersey. And so whenever anyone asks me to do something toward their DMin project, I have to say yes. And I spend my days as the director of spiritual care at Robert Johnson University Hospital. So we are a large level 1 trauma hospital right by Rutgers campus. And we have a pretty extensive CPE program with residents, with interns, as well as with supervisory students. I've been in leadership in ACPE, where I led the certification commission. And then when I'm not doing all of that, I also have a private practice as a spiritual director and do a lot of writing about chaplaincy and the skills that are needed in order to do this work well. I am hopeful that we won't be interrupted tonight by my 2 boys who are 9 and 11, who like to make appearances every once in a while. But I did promise them extra Nintendo time so that they could leave me alone, but apologies in advance if that happens.
Thank you. Chaplain Pollet, would you introduce yourselves to the panel, please?
Hi, I am Chaplain Pollet. I am actually originally I was born in New York, raised in California. So since 14 years old until about 2014, I moved to Iowa, Clarinda, Iowa, to be exact. And I've been doing chaplaincy since 2011, which started in California, but it kind of continued as I journeyed through mid-America. I am an author. I believe that chaplaincy should not only be for adults. I wrote a book on chaplaincy for children, teenagers, and young adults because I see the need. for chaplaincy in those areas. And that book just came out 3 months ago. I am married. I'm living in Puerto Rico for 3 years. And I'm getting used to the paradise, as you say. You know, paradise does come with some other things that are not in my control. But the hospital that I work at is amazing, and I am blessed and honored to be serving the people of Mayaguez and beyond. And that's a little sector of Puerto Rico. So it's not a barrio, but it's like a little town, like San Juan and Mayaguez. And basically, I'm living the dream. I am in the process of returning back to or starting with Liberty University, the PhD. I think it's the doctoral program. I'm praying on it and seeking guidance. And I'm glad to be here. Nice to meet you all.
Thank you, Chaplain. Chaplain Cuenca, could you introduce yourself for us, please?
Sure. Yes, my name is Ramel Cuenca. You know, sometimes it's kind of hard to say, but the C are pronounced as a K or a Q. So,
Okay.
so I'm originally from the Philippines, and I served as pastor for many years and served 18 years as level 1 trauma chaplain. I'm the co-founder and COO of ICPT. And just a pleasure to be with you all tonight. And one of my greatest accomplishment in life is, bar none, is having 6 grandchildren. So that's it.
Just as an aside, Chaplain, I spent maybe about 2 years in Cebu.
Did you? All right.
Wonderful place. I enjoyed it. Great
Yeah.
place.
They're having a hard time right now. So
Yeah, they are.
the typhoon is hitting them hard. So
Yeah, I have several friends there that I pray for daily. I'm hoping they weren't involved in the trouble that they're having there. So thank you for being here. And then we have Dr. Wright. Dr. Wright is from Liberty, my alma mater and my current school. So I gotta give him a hey, Chaplain Wright.
Well, thank you for inviting me to come. And we just started our program in 2018 at Liberty. It's grown. I think we've since then trained about 170 students. We have right now we have getting ready to start a spring semester. We have requests for 50 students, and I only have 4 educators. So I'm trying to decide. We only allow 10 per class, but the Lord's really blessed that. But I also am a CPE educator for the St. Louis VA Medical Center, 2 hospitals there. We have residents and students. For Marion, Illinois, I'm the CPE educator there. We have residents and students. And I've trained the one in St. Louis, and I'm waiting for them to make him the educator record so I can retire from there. And then the one in Marion hopefully will be ready by mid-year next year, and I can retire from there. I work at and spend more time at Liberty, which I'm a full professor now. Also, have been a pastor for 56 years, been ordained for 55. Have pastored 4 churches, still pastoring. I'm a senior pastor, but I've trained the elders and the deacons in the CPE method. They don't know that, but they really do a lot of ministry and a lot of work there. Served on a few committees back when we had regions and ACPE. Been an ACPE educator since 2000. And I recently, we are developing the program of LCPE, which will be moving away from ACPE, mainly because of the Department of Education situation that all of us know ACPE's been in. But excited to be with you tonight. Married, we have 14 grandchildren. I may have to check off for a few minutes or so about a couple of the grandchildren. We have them ranging from 22 to 1 year. So we're doing fine and having fun. And you've heard the old saying, if I'd known they were this good, I'd have had them first. That's really what So thank you for allowing me to be with you.
I'm so blessed to have each and every one of you here tonight. Wow, you have no idea how good I feel listening to you and seeing you guys. Thank you so much for being here. So the way I like to do this as we move into our moderated
I'm
session,
so sorry, excuse me. There is a Daisy Black here. Is she part of the team?
no, she's a guest.
Okay. I just want to make sure she didn't get forgotten. Thank you.
No, thank you for reminding me. I read a book on Zoom for Dummies in preparation for this event. So I'm not real familiar with how to use Zoom, but thank you for, if I make any mistakes, please do as you did, stop me and correct me. I appreciate it. So as we move into the moderator session, the way I'd like to do this is I'm going to present a question and I'm going to ask each one of you to kind of chime in on it and then see where we end up with after you all chime in on it. We're going to do 3 different sessions. The first session is, what is a chaplain? What does it take to be a chaplain? The second session is going to be, what is CPE? Why do we need to do CPE? What's the advantage of being a graduate of CPE? And then the last session is going to be, how can we get CPE here in Puerto Rico? The reason why I wanted to do this particular presentation is I know I completed 1 unit of CPE in Pennsylvania at what was called the Abington Memorial Hospital back many, many days ago. I don't want to tell you when because it will date myself, but we can say it was more than 20 years ago. I need to get 3 more units of CPE, and trying to get those 3 units in CPE has been almost as difficult as putting this panel together. So I need to know how I can get that done. So hopefully you experts tonight will give me some ideas on how to get that done here in Puerto Rico. Without further ado, let's get into the first segment. Why do they consider chaplaincy to be the fastest growing ministry?
May I say something? Can I answer that? Or
Sure. Anyone can answer.
so from what I'm hearing from people, because I was reading an article about chaplains who are atheists. Yes, there are atheist chaplains. And I think the reason it's growing is because we don't go with our own agendas and we're not pushing our own religion. We are going and providing a listening ear and the ministry of presence. And just knowing that they prefer having someone who doesn't come in with an agenda. Not that pastors come in with an agenda, but most is to come in with their belief system. And I believe that people are starting to embrace chaplaincy. There's so many myths about the chaplaincy, that chaplains only go when somebody's going to die. So seeing educated chaplains coming in with a fresh perspective and just sometimes just being silent works for them. And that's what I think people want to have. They don't want to have somebody pushing some sort of religion down their throat. And I was kind of taken aback when I read regarding this chaplain who was on the news, and she's an atheist, and I was thinking, how can you be, you have your MDiv and then be a chaplain, and especially an atheist? But then when you look at the whole entire picture, it makes sense. It makes sense because her perspective comes from, I want to make sure I provide psychotherapy or just a listening ear. So active listening is very important in a chaplaincy as well. So I'm going to go with that. Anybody else wants to chime in?
Sure, I can chime in. So I think you also had asked us to identify how we would define ourselves as a chaplain. And I think that's one of the biggest issues we have within the field, because sometimes I walk into a patient's room and they're like, what's a chaplain? And maybe they've been in the military and they have that for a frame of reference. But we have a long way to go in terms of marketing. Usually I will tell students they can introduce themselves as an extra layer of emotional and spiritual support. And we are also the only discipline within the hospital that's catering to three different populations, to the patients themselves, to the patient's family, and then to staff. And in the 20 something years I've been doing this, that's where I've seen the biggest shift is the need for staff support, especially as you look at the field of healthcare and all that is going on with burnout, and which has gotten, we all know that's gotten worse since COVID. So many chaplains are utilized very informally or sometimes in formal ways by staff. Even if there are fantastic employee assistance programs available, people want someone that they know. So I have been surprised how I've been at my present hospital for a decade, how we're getting utilized more and more for staff debriefing on difficult cases. The other reason I think chaplaincy, at least in the hospital, that's where I can speak to it, is growing, is because of the increase of the number of individuals who might identify as SNR in the literature, or spiritual, not religious. So I think last time I checked, it was 22% say that spirituality is important, but they are not connected with any sort of a congregation or faith home. And because of that lack of institutional involvement, when there is intense suffering, or even a routine hospitalization that brings up people's questions of mortality, and it's the first time they could be looking at it, they are hoping for someone to help guide them with some of these conversations. So that's another reason I think it's growing. And then the last, I'll say, at least in my setting, and I think this is true for many of you all, we are very much involved in advanced care planning. So we are the ones that are helping individuals do advanced directives, filling those out, because sometimes those conversations bring up a lot of grief. As I ask someone, well, what would you want done if you were in this scenario? They say, oh, well, when my mom was in this scenario, this happened and this was hard. So I could go on and on, but those are, I think, three main reasons that I suspect chaplaincy is really growing right now.
Yeah, I think I totally agree that why it's growing is because there's a great distaste for traditional, you know, y- traditional spiritual providing. Um, uh, Part of my job also, I also work as a VA chaplain, and with the military, especially with the veterans, they have a lot of moral injury, PTSD, and moral injury. Sometimes it kind of overlaps together, but and yeah, so a chaplain that walks alongside them, and just deal with their spirituality is more welcome than having it approached in more traditional religious framework. I mean, it's helpful for some, but definitely it's a growing need. As a matter of fact, chaplaincy, especially in our organization, we have seen the expansion of chaplaincy not only from hospitals, but used to be nursing home, don't have any now. They do, are very intentional in having that. We have recent expansions like the corporate uh, chaplaincy. Tyson Food, we exclusively train them for CPE for their chaplains, and they have about 300 plus chaplains in their employed by Tyson Food, and it's been a great working environment. From workers have said how wonderful it is to have a chaplain that can go alongside, and I think that's what chaplaincy is. I think Howard was said maybe it's not, it doesn't capture it, but it's the art of going alongside, a person, and however long that may be, when to get off and when to get on, So, um, yeah. 。
Wonderful. I'm kind of waiting for Chaplain Wright to share with us a little bit.
I forgot I was muted, but all the things you all have said bring back a lot of memories. I actually started working as not a volunteer, a contract chaplain in the VA Medical Center in 1995. And I really got some great experience there, which is really what pushed me to take CPE. And then taking CPE, I kind of got the bug and decided I'd go as an educator. Now, educators today in the ACPE world have it a lot easier than I had it. I don't know when you all got certified, but there was a lot of problems, a lot of struggles with people. We really went through the mill. They really pushed us to the limit. And while I hated it while I was going through it, I thought it was great training, because that's what you do when you're a chaplain. You walk through the things that people walk through. I think one of the reasons that chaplaincy is becoming the fastest growing ministry is because of all the struggles that people have in our country, as well as other countries. The catastrophic things that are happening where they need a chaplain. I think the biggest jolt that I saw, I call it the plandemic. I didn't call it the pandemic, because I think they realized chaplains were the only ones who could really minister to people in the hospital at that time. And all the tragedies that we have, the things that are going on, chaplaincy has become a really needed, recognized ministry. And being a pastor and seeing both sides of that, I just really see the need for training chaplains. And I have told the seminary, and the students told the seminary, that every Master of Divinity student should take at least one unit of CPE. And some of them taking us up on that. Now they're on their third and fourth units, because they understand how important it is to minister. There's no other class in any seminary like CPE if they don't have CPE. And so they've come to realize the growth of that. I think there's some struggles with CPE right now, especially with ACPE, who I've been with ever since I've been an educator. And my hope is they get that straightened out. I've had conversations with some of the people in leadership, especially even the executive director called and wanted to know how they could bridge the gap between where we are and what we need to be with CPE. Some of the diversity things, some of the things that we're seeing. People need chaplains. They need people who can be honest with them, open with them, not have to look at them every day when they go back to church or every Sunday, that they can have a confidential conversation that is meaningful. So with all the VA groups that I've led, all the chaplains that I've seen, all the ones that I've trained, and been a part of that. And I always tell students, I'm going to learn more from you than you do from me during this unit of CPE. And that's always been the truth. I've always gained more knowledge and more understanding from them than they have from me. They don't agree with that, but I've watched it, and I've watched myself grow. And I think anybody who's a continuous learner or a lifelong learner will believe that CPE is one of the ways to get you there. You just can't stop. You got to keep going. I'm 72, so I'm still going strong. I plan to continue. So
I got to thank you guys. I had we were required to prepare 7 questions in each segment, but you guys are doing such a wonderful job. You're answering most of the questions in just this one bit of dialogue. Thank you. The next question I have is, what is the process of becoming a chaplain? And again, anyone can chime in if they feel moved.
well, you go to Liberty, I guess. I don't know.
So I think this is where we can do a lot more to professionalize our tradition here. I frequently complain that I get calls up from people saying, I'd like to come and be a chaplain for a day. Can I pray with some patients? And I joke, I'm like, I would never call up neurosurgery and be like, can you let me operate today? Like, what's going on? So I think really helping people understand that this is a vocation that requires a lot of training. So an MDiv degree, which is usually a 3-year degree, in addition to 4 units of clinical pastoral education or 1,600 hours of postgraduate clinical training in order to even be eligible for board certification as a chaplain, which then has its own requirements of 2,000 plus hours of work, as well as a number of interviews and essays and applications. So it is an undertaking for sure that I really try to emphasize. We're more than just a church lady who wants to come by and cheer someone up, which I think is a pretty common misconception.
Yeah, I like that idea that, I think you said it perfectly, that we need to professionalize our field. If I would make a comparison, I think chaplaincy is during its social work, probably 10, 15 years ago, where there's no recognition was this. So one of the things that we're hoping with was this is really bringing the level of CPE CPE training, and what's this chaplain's requirement, because as of right now we still have areas in places that accepts someone who's just a warm body, right? I know there's in Florida sometimes they just if you have um, a a bachelor's degree and some kind of church experience, then that qualifies you. So there's definitely a need to what's this to increase that, and it's for many reasons. It's chaplains are have a difficulty in terms of, in some places you're well utilized, in some places they don't know what to do with you. It's just because we haven't had a more of a national expectation like social worker that have codes for reimbursement, things like that. But we're partnering with an organization that's working on that. We've successfully have introduced codes now for chaplains, and the next step is adoption of that will become more national. But yes, professionalism needs to be established. A certain standard nationally need to be established, I think, to elevate chaplaincy. It's growing, but yet it seems like everybody's going in all directions, you know, um, because there's a lot of misconception, as someone has said, what chaplains are. I get people sometimes come to me, they have a badge that says chaplain, and they did what says had a training of 2 weekend training, and they received that badge. So there's definitely was this growing. We have a lot to, in our industry, growing edges, I should say. But yeah, to be a professional chaplain, but thankfully it's that awareness is growing in it. I think you can rarely find a chaplaincy position now in metro areas that would be less than an MDiv, and at least board certified chaplain as a qualification for employment.
I got to stop. When I first met Chaplain Pollet, one of the discussions that we had was, and it's actually a question here and among the seven, we talked about the idea of many churches here in Puerto Rico are having like weekend or even 2 week seminars, training people to be chaplains, giving them a badge, and then sending them into the prisons and the hospitals here in Puerto Rico. And the other reason why I wanted to have this panel discussion is because I'm from the old school. I believe that if you're not trained, you can do more harm than good.
Mm-hmm.
And so doing it that way, what I call lay chaplains, I'm not sure that that's the best way to proceed when we're talking about chaplaincy. So the question that I had is, and we have about 10 minutes to answer this one before we move into the next session. What are lay chaplains as opposed to professional chaplains? And we may have answered that, but I want to stress that.
Okay, so from my experience here in Puerto Rico and in California in the San Diego, Riverside area. The lay chaplains, we had to train them anyway in hospital, CPE style, for free. And they couldn't get on the floors until they did all the role plays, all the cycle procedures. But here, even the governor, the former governor, I don't know about this governor now, was thinking of putting regulations, because some of these chaplains come into our hospitals or come into the hospitals and they're accused of stealing, being aggressive. They're not following through. And so we were having a group of people saying, listen, I have my master's in psychology, and I'm working on my master's in theology at the moment, and also getting into other things. So we were talking about possibly creating a formal document to send to the government so that they could understand, hey, we are so different. We have to be educated. It's like having a coach versus a psychologist. I can go to a coach at any time. They can be a little certificate, that's perfect. But if I need to have real psychological assessments and also be having the best result, I'm going to go to a psychologist. The same thing applies for lay chaplaincy. They're making it too easy to go into nursing homes, facilities, and it's making us professionals. I'm going for my board certification, so I'm excited about that. But making us look, or not helping us look professional, even though we're doing everything that we can do. And I think I think that badge. I mean, like I've seen some really shady stuff. Very lack of a better word, that if things that shouldn't be happening because they have that badge. And I think anybody can have that badge. Anyone can have the badge. I don't even think that they do a background check. And that's what's scary.
I think there's a place for community involvement. Is good for the hospitals, right? Especially for the hospitals to have those kind of engagement. I could think of several facilities that we have been working with, that one of the requirements that they have for their volunteers is to have at least a CPE unit. They don't have to pay for it. It is provided by their volunteer program, and they're trained, and so they would know how to be present and not to kind of assess what really the issue is, and provide intervention appropriately. So I think there's place for both, but definitely there needs to be careful training in order for that to be effective. Because I've seen it with Common Spirit, they do that. Hospital systems, they do that with their group. So, but bottom line is, I think there just needs to be better training, whether you're doing it professionally or you're doing it as a volunteer, or being a lay chaplain. I don't know if you want to say lay chaplain, but spiritual care volunteer is what the term that they use, and they require their folks, in order to volunteer, is to take a unit of CPE.
Well,
We're
after
kind of
about
coming out against the time limit for this session, but I have two more questions, and I wonder if you guys can help me with those questions in maybe the next 5 minutes. The first one is, what is an endorsed chaplain? And why? And the other question would be, why is it a good idea to be a board certified chaplain? And I know you can't answer that really faithfully in 5 minutes, but can we try?
Well, I'm the one of the associate endorsers for Liberty Baptist Fellowship. Is what we do as endorsed chaplains. We've gone from 240 chaplains to almost 600 in about 3 years. And being endorsed means that you have someone to back you up. If you have a certain religious belief that you have, if there's something that you stand for, and your organization requires endorsement, like the VA hospitals do. But if someone comes and asks you to do something that goes against your religious belief or your constitutional values, then the endorser comes in and stands up for you. Also, endorsement with us is like a huge family. We do counseling, we do ministry, but endorsement, you have to be endorsed to be in the VA hospital, have to be endorsed to be in the military. Didn't have to be endorsed in many secular places, but it was good to have an endorsing agency so that you could use that for a backup. Being a board certified chaplain, we just recently connected with Juliana Lesher, who used to be the director for the chaplains at the VA Medical Center in Washington. She's now started a evangelical board certified chaplain group, and they'll have reciprocity with ACPE, NAVAC, and the other board certifying agencies. So we're pretty excited about that, because being board certified, what I experienced when I was at Baptist Health in Paducah for 15 years, I was also chair of the ethics committee. And when I went there, they had probably 8 to 10 to 12 lawsuits a year. That's kind of small for even some big hospitals. I was trained in St. Louis with my residency, and worked with St. Luke's Hospital, also Barnes Hospital, and took courses in ethics there. One of the reasons that they had so many lawsuits is because their chaplains were not certified. They didn't have a certification. 2 years into our program at Liberty, the dean of the seminary said, "This is the only course we have that offers a credential." And so being board certified gave a pretty heavy weight, because one of the questions they would come in, if a chaplain happened to make a mistake, they would come in and say, "Okay, what's your training for the chaplain?" If they're board certified, they've got CPE, that says a lot for the insurance company. But some of the volunteer chaplains, when they come in and say, well, they don't have any training, they don't have any credential, the hospital will go ahead and settle, because they wouldn't have a leg to stand on. So being board certified gives you a recognized credential, so that people can see what you are, that you've gone to the trouble of being trained, being endorsed, being certified, to make sure that you have some knowledge and ability to do what they've asked you to do. It's very risky for a hospital to not have a board certified chaplain, because of all of the lawsuits and things that happen every day in the hospital world.
Dr. Wright happens to be on the faculty at the Liberty Chaplaincy Center. And the reason why I'm mentioning that is the Liberty, some of the staff at the Liberty Chaplain Center also have an endorsement agency, for lack of a better term, called the Liberty Baptist Fellowship. And they do endorse chaplains. I'm proud to say that I'm one of their endorsed chaplains here in Puerto Rico through the Liberty Baptist Fellowship. So thank you, guys. We're going to make a transition now. Before we do that, I just want to thank you guys. You guys are absolutely wonderful. My God, I'm so happy that you're here. Let's make this transition into a new subject. Segment 2, I call it. The first question is, what is what is clinical pastoral education? And before we get there, let me say this. We have 2 representatives from the Association from Clinical Pastoral Education through Dr. Wright and through Chaplain Davies. And we have a representative from the ICPT through Chaplain Cuenca. So I just want to ask you guys to kind of share your perspectives on ACP versus ICPT, if you would. Anybody?
Well, I don't know if I can speak to that, but I think I can speak to CPE in general, which is really a psychodynamic model of education, where it is not just about receiving lectures, and then going out and knowing everything up on the patient units. It is experiential learning. So we give students a little bit of an orientation as much as we can tell them in terms of logistical practices, but so much of the learning is based in action, reflection, and then new action. So it's really a way of learning by doing. The other thing that separates it from a lot of educational programs is the focus on the individual, on the chaplain student themselves. I neglected to share before, I also got an MSW and got certified as a cognitive behavioral therapist. And I can tell you that education and training was not as intense as CPE, and really the deep work of looking at our own narrative history, how that helps us, how that hinders us, um, all of the knowledge that is gained at being able to anticipate needs from patients from all sorts of faith traditions, from all sorts of medical diagnoses. So there's really so much intense training involved. And I would be remiss if I didn't call it transformational, because that is a term that comes up a lot. In fact, one of my students today was like, I'm struggling with the term. I want to say liberating. I want to say exciting. I was like, does transformational fit? He's like, yes, that's it. And it's hard to really find that in just a regular classroom setting. You do have the component of the individual learner, and we do individual supervisions with students, but then you also have the component of the group and the power of the group experience, both to give feedback to one another and then also to care for one another. And I find that that is really what a lot of people benefit from, having that cohort and going through it together, much like a lot of people have in their DMin programs, but with a little bit more intensity in CPE.
Yeah, it's the action reflection, method, and it's more of an introspective learning. Uh, yeah, I can't. I have part of my CPE was with. As a matter of fact, when I finished my master's of divinity in pastoral care, I had was required to have 2 units of CPE, and I did that with ACPE. And I had the privilege of co-founding ICPT. When we went through the process, one of the things that was a big question for us is that we wanna maintain that action reflection dynamic, because I think that's where the transformational that's very transformational, because you take a raw experience into a clinic, right? And but one of the things that was missing for me is that I didn't have the same experience with taking one. I had a great supervisor, educator, and then when I moved to level 2, it's a little bit different. So one of the things that was this ICPT, is that we have more of a standardized curriculum that goes along with the action reflection process. Um, and this was this the standardized was this really was a product of a research of what is needed for pastoral care in the workplace. And once that we're able to, as a matter of fact, it's the Spiritual Care Association that put out this study. And once they were able to determine what areas of pastoral care need that the marketplace is looking for, then they had uh, subject matter experts to develop these curriculums to go along with it. And so, as ICPT, when we were looking for more of a standardized process, because our accreditor saying, well, you can't have an educational process if you don't have a standard that you go by. And so we adopted, as a matter of fact, we bought the license for that curriculum. So I think with ICPT, whether you take CPE in Alabama or in California, you will have a very standardized curriculum along with that action reflection dynamic that's very crucial in the CPE process education. So
It's kind of hard to believe that our CPE all started by a man named Antoine Boison, who was in a mental institution being treated. But in that process, a very intelligent person, which I see a therapist once a year just to get my act together. And he says I need to see him once a week sometimes. But to think that the process that he went through allowed him to develop the way that we grow and the way that we work, that just shows to me the very basic thing about CPE is about the inner person, about self-awareness, self-reflection, the ability to look at yourself, to understand how I believe the Lord can use you in your ecosystemic development to become a minister, and yet at the same time, not a turn or burn, justified or French fried, get saved or microwave person, but go in and just be there in the moment. And what I train students to do is allow the person to develop their own understanding of who they are and how that will affect them and enable them to grow. And the sad part about chaplaincy is you maybe only get to see them once, maybe twice. So we train, I'm sure all of our CPE, we train them to be in the moment, to give the person something to reflect on, and grow from their own process, and then maybe call you back. That's always to me the greatest joy of a chaplain is when somebody calls them back to talk to them again. I think you've made a big difference when that happens. So with everything you all have said, plus the fact that if chaplaincy is a calling to me. I think pastors who were frustrated with their ministry, so they thought they would go be a chaplain. And after 4 units of CPE, they go back to their church and do a pretty good job. And, they always say that the judges are attorneys who couldn't make it. I've heard people say chaplains are pastors who couldn't make it. And I always tell pastors, before you're talking about making it, you need to try it. Try just 1 unit of CPE to see what that will do for you. So to me, that's what clinical pastoral education is.
You guys kind of answered the question that I had for the second one is, what pastoral skills are developed during CPE? I think you guys did a wonderful job of covering that. So I'm going to ask a question that's more near and dear to my heart. I'm 71 years old, and I heard it said that there's more days behind me than in front of me. So I'm wondering, at this age, is it realistic for me to consider completing those remaining 3 units of CPE that I need to complete?
Yeah,
Absolutely.
Well, yeah, not, how am I going to put this? It's never too late to find out who you are. It's never too late to find out who you really are. And CPE has helped me understand why I do what I do. I've had so many aha moments going, I don't know, I just don't like to talk to my father. Why don't you? Well, you over here, you did this and you did this. And it seems like you have to talk to your father. And then suddenly it's like, oh yeah, I remember that time. Never too late to find out who you are. Because when you know who you are, you see your purpose, and then you can go and into each room that's a different world you're going to come upon, and you're going to be able to help individuals. I mean, I've seen chaplains where they actually haven't done the CPE, and they'll sit on the bed and talk to the patient about their problems. That person still hasn't healed. It's never too late. I'm just going to put it that way. When you find out where you're at, mentally, emotionally, spiritually, physically, you have a sense of being but belonging to an even greater purpose. And that's what chaplaincy is for me.
Yeah.
That's beautiful. The only thing I would add is something that Dr. Wright just said, that usually there's just one encounter with a chaplain, right? So the chaplain's just meeting that patient or that family member for that one time. And to me, that speaks to the fact that anyone can enter into this career at any time. There's no ladders to climb, the power is in that moment of connection.
Yeah.
And so I think that the question back to you, Ronald, is, how do you want to spend your time and your days? And so if it is that deep introspection, and that hard work of looking at yourself, then CPE is the answer. And if it is, connecting deeply with people who are suffering, again, chaplaincy is your answer.
Yeah, I'll tell you, it's you know, if I wasn't doing it professionally, I still probably would do it because just knowing that I know my stuff, I know where I am, that I don't mix that with a person in front of me, and that I'm dealing with what they are needing and not muddy that with what my need is. As a matter of fact, when I first went to when I first when I started my I did two MDivs. I did MDiv in the Philippines, and I had to redo it here in the States uh, because and one of the things that was really quite alarming for me was that they said that 80% of people that are in the helping profession are there because they need to be needed. Whew, that's very dangerous.
Yeah.
So I think it's so important that we go through this training of making sure that I know where I am. I know my
Amen.
my issues, so that when I enter somebody's life, I'm not bringing mine, but I'm present with theirs. So yeah.
Well, when you I had an old 75-year-old professor tell me when I was doing seminary at Southern in Louisville, when you
Ah, that's
when
where
you
I went.
when you stop learning, you stop growing. When you stop growing, you start dying. So there you go.
It's a good word.
Great. Two more questions in this segment. Because I want to reserve one of the questions for the final segment. Um, how much time does an average student, commit to CPE a week?
It depends on if you're a resident or an intern. If you're a resident, you're 40 hours a week, usually a regular pay scale or a stipend. If you're an intern, you usually have class one, maybe sometimes 2 times a week. But then you spend your time in individual supervision as well as your clinic time. So, it just really depends on the program and what they've designed and how they work it. Our
Yeah.
intern, the VA doesn't charge anything for internship. They can't. The government won't let them. So CPE is free there. But we emphasize that you have some clinic time to make up that more than hopefully pays for your tuition, if you want to call it that. Our stipends, they don't even pay their fees. The VA where I've served, the two of them, they pay their fees to ACPE, and they get a stipend. Usually in St. Louis, it's about 42.5, and Illinois, it's about 41.5, and plus they get health insurance. But they spend 40 hours a week. I always tell everybody it's easier to do a residency as an internship, because when you get off at 3:30 or 4 o'clock, you can go home. As an intern, you got to come in on the evenings and weekends and make up your time. So it just varies.
Yeah. Uh, It does, it does vary, and we have some residency programs that do require a lot more, but at the very minimum, it's 400 hours per unit. And so 300 of that will be your clinical, and 100 of that will be your classroom, including your one-on-one.
Now imagine as you go higher, I know there's level one, there's level A, there's level 1B, level 2A, and level 2B. So does the curriculum change as you progress through those levels?
Yes.
Can we
Yes.
talk about a little bit about that?
We, Go ahead. I've talked too much. Somebody else.
Yeah, at least within ACPE, we recently, well, not so recently, a couple of years ago, changed our competencies for education. And so now it really does change with each level. There are some things that are basic that you're going to be doing every time, like probably verbatim. So writing up your case studies, what you did, what the patient did, what you said, what the patient said, and doing analysis questions. Those I have my very first students do those, and I have, students that have been doing this for a lot longer do those as well. Same thing with individual supervision, same thing with kind of the group experience. But the features of the curriculum do change. So for instance, when people are getting when they're more in 2A or 2B in my program, we do more with in-depth charting, research, spiritual assessment. That comes a little bit later. When people are first starting out, that's when they're looking more at their own, kind of story and how that's impacting them. We're teaching them very basics about, okay, this is what Catholic patients may need. This is what Jewish patients may need. But it becomes a lot more nuanced the further that you go in the program. So that's just broad generalizations of what it looks like in our program.
Yeah, I think it's more of a terminology. I think with ICPT, we've was this fashioned it to where one builds up to two, builds up to three, and then builds up to four. So the higher, the deeper you get to it, the more expectation, of course, is expected of you, and it's required of you. So, and that may include was this research and such. So.
At Liberty, in the fourth unit of CPE, fourth semester, their learning goals becomes the board certification competencies. And so when they leave there, I always tell them they'll be like Jesus at 12 in the temple when they go for board certification. So they complete their board certification competencies. And that doesn't mean they're going to pass right off the bat. We do have some that while they've been in their fourth unit CPE gain provisional with APC or other places. So, that it's just progressive training, but then you don't stop. You got to do continuing education units. They're required to do 50 a year, which is pretty high for most, but they're required to do those and present those. And then in ACPE, we have consultation, we have peer reviews. We just finished our 6-year accreditation at Marion. Last year, we got our 6-year accreditation at St. Louis. And so, every 6 years, you're actually every 3 years, your portfolio, and the accreditation guru can tell us that. But every 6 years, they come on campus and they look over your program, they look over your library. It's a continuing growing process. Your handbook's about 100 and how many ever pages long, and everything's spelled out in there. And it's just there. Now, if you want to know where you can take CPE, you can take CPE at Liberty. How's that? So, because you can use your clinical setting where you are and still attend the classes. We do require the first semester of CPE, they have to come on campus for 1 week of intensive, and we have 50 hours of education in 1 week. So it is intensive. And then we meet just like we're meeting now, synchronously for the rest of the semester. For the other 3, you do not have to come on campus because it's very expensive. But we meet for 1 week synchronously, and then the whole semester we meet synchronously. So it's face-to-face for us. When I went to Liberty, they have 100,000 students online. And they said, we want you to do this online. I said, then you want to get somebody else because that's not going to happen. You got to meet with people face-to-face to do effective CPE, or that's my philosophy. So that's the way we do it.
When I did CPE, and it was in 1996 at the Abington Memorial Hospital, one of the things that I noticed that's changed as I've been doing research in its doctoral program is that the chaplain resident or the chaplain, even the chaplain doing CPE without becoming a resident, are more involved in the medical procedures of the hospital. When I was a chaplain, we never did charting. That was just taboo. In fact, we never touched a chart. And if we needed to share any information about the patient to family members, we needed to get clearance from the medical staff first for that. And I noticed in the research that I've been doing and reading, that's changed now. The CPE students and the residents are actually making notations and charts. They're actually interacting with patients' families without the medical staff. So it's actually evolved a lot, it seems. Am I on safe ground of thinking that?
Yes, you are definitely on safe ground saying that. If we are going to professionalize uh, chaplaincy, we need to rise to the level of where, of what kind of licensing and certification, just like social workers have. They have a national, recognized by the government. They get Medicare reimbursement for doing such. With chaplaincy, I think we're still in infancy, and I think there's definitely a great need that's going to be what's this and initiatives has been but is being put forth, and just like I mentioned prior, that several chaplaincy codes have been already accepted by Medicaid, but facility adopting it and using it is another thing. So, but I think it's promising because we're growing
Yeah, I saw that
as an industry.
there's actually a CPT code now for chaplains. When they provide their service, they can actually do it. And I guess the hospital itself will bill under that CPT code.
That's correct.
I'm a licensed marriage and family therapist. I took the national AMFT exam back in, oh God, in 2006. And I practiced as an LMFT since that time until I came to Puerto Rico about 3 years ago. So I heard during this session something that interested me a great deal, and that is you either do CPE or you have 1,500 hours of clinical experience. Help me understand that more.
No, that's what when I was saying 1,600 hours, that is the CPE.
Okay.
A postgraduate clinical experience. So that's 4 units at 400, if I did my math right.
Yeah.
400 hours each unit. But then for board certification, they do require more hours before you can get fully board certified, which is similar within, a lot of other licensing fields.
And those hours are full-time or part-time paid hours. You have to be a paid chaplain to be board certified for those. That's why I say provisional. They can gain provisional, my understanding, but they can't be fully board certified until they complete their number of required hours of paid chaplaincy. And then they can become fully certified, but they have to have, so you talk about 100 hours of education, 300 hours clinical time for each one. And then they got to do 2,000 hours after that before they can be board certified. So when they're hired to say that they're board certifiable. So they can work and then, they're ready to be board certified.
The other piece we haven't spoken about as much yet, and this is not my expertise, is hospice. Because hospice does have the regulation that they are required to have a chaplain. And so there are a lot more jobs now as a result. I think for a while, hospice organizations didn't always have the same level of education required, but that I see is changing quite a bit. And so now a lot of hospices will require a master's degree in addition to the 4 units of CPE. Yeah. But I always tell my students, like, look for the hospice jobs. There are a lot of jobs in hospice. And a lot of times those are PRN or per diem jobs or part-time jobs that can then potentially turn into full-time jobs as well.
Yeah.
And they're usually they require 1 unit of CPE, but mainly because of Medicare reimbursement. They got a certificate so they can get Medicare reimbursement. But I tell all of our students who say, I need 1 unit of CPE so I can do hospice chaplaincy. Well, 2 organizations now has moved that to 2 units of CPE. And I tell them that as Medicare reimbursement beefs up their requirement, you're going to end up having to have 4 units of CPE even to be a hospice chaplain, because, I hear people say we don't have national medicine, but 80% of the money that goes to any hospital other than the VA, 80% is Medicare reimbursement. And about what, maybe back in 2016, 15, you could lose some of your Medicare reimbursement if you didn't meet the standard and you had to work to gain it back. And one of those was making sure that all of your employees, not just chaplains, had effective and up-to-date credentials. So they're doing that with hospice now. There's 2 places that require 2 units, and I tell them it won't be long before they require 4 units. So get your CPE while you can. So.
Yeah, there are many. We have a lot of chaplains that are training with us that are being required by their workplace to get at least 4 units and become board certified. And of course, it's a challenge for those who are more in the rural area. And but the way we deliver our CPE training is more of a hybrid model, so that is able to meet that need. But speaking of with this Medicare reimbursement with chaplaincy in hospice, it's a nice recognition for a chaplain. As a matter of fact, I work as a hospice chaplain for a little bit, and a interdisciplinary meeting will not be valid if a chaplain is not there. But the only problem with that is in the Medicare world, it's just your presence. You don't really have a service connected code for reimbursement. And so it's a good sign that the government is trying, I think a spark of hope of what chaplaincy could be, and being recognized by the government. And I think, just like with social work before, you didn't have any of those codes, but now you have codes that you use for Medicare reimbursement. And I think that's the path that's being developed, to use more and more those very few right now chaplaincy Medicare codes that's available.
Well, I think the CPT code kind of opened the doors for the medical coding now for the chaplain services. And because that's the same code that I use as a therapist to bill through Medicare or bill one of the insurance companies. So chaplains having that will be able to do that same sort of billing.
Yeah, it's the reality, right? We probably chaplains are the most educated but the least paid professional in a facility. And for the simple reason that we don't have this codes, our services to do, get our medical reimbursement. We used to do in our hospital when I used as a chaplain at a trauma center, we did advanced directives, but we don't get reimbursement as chaplains. The doctor do.
Good to see
We did the job, but the doctor gets the reimbursement.
I apologize. I've got to get off for a little bit. You may be gone by the time I get back. I got a family emergency I need to talk to someone about. So really good to meet you all if I don't get back in time.
We are in the final segment of our meeting, and I need to express some of my prejudices, if I can. I am really enamored with the ICP program, particularly because of what Chaplain Cuenca has already said, and that's the hybrid model.
Correct.
Here in Puerto Rico, doing a resident model is difficult. There's not many hospitals to work at. Chaplain Pollet is at one of them, but there's not too many here. But that's a struggle in finding a hybrid model here also. So that's really what I wanted to talk about in this section is where does one find the ability to do CPE in a place like Puerto Rico, where there's very few hospitals that have chaplaincy departments. The people here in Puerto Rico are not totally familiar with CPE, what it means, what it does. But through programs like ICPT, it's an opportunity to introduce the island to CPE. So I'm wondering where, if me as a CPE desired person wants to do CPE through a hybrid model, what are some of the agencies that I should be looking at?
Yeah, so
Well,
I'll just add that ACPE does also provide distance or virtual CPE. And
Oh, okay.
I can give you some recommendations of colleagues of mine that I think do it well and do it internationally. And so people can be in whatever setting they are, and then all of their educational time is on Zoom like this, but they are finding local placements. So sometimes becoming a volunteer, sometimes, having an arrangement with, and sometimes it's even parish-based. It doesn't have to be hospital-based. That tends to be the model a lot of people follow. So they are out there. You can do distance virtual learning for ACP as well.
Great,
yeah.
thank
And I
you.
So
think, I'm sorry, our training center not only does CPSP, but they're also going to be bringing in ACPE. So they're going to be two different in one location, but two different instructors, two different, because I guess they want to provide ACPE. There's clinical and then there is research. And so they're both different, but they both provide. But ACP right now, they're trying to figure out how they're going to bring it to our location because people are complaining because it is costly. But I would like to do ACP another 2 years. I know I don't know, call me crazy, but I think it's great. Um, but it's right now it's so hard because there's so many regulations here, but in the island itself. But if you're going to do something online, then by all means, it would probably be best for you to do an online program than here in Puerto Rico. For now, it's virtually impossible.
yeah, with those is with ICPT, we basically leverage our Canvas and Teams, and basically as a one ecosystem that that works together, and so um, uh, you can, just like I already mentioned, your clinical out. We have a lot of priests in their denomination. In order for them to get their ordination, they're required to have CPE as well. So they can do parish-based CPE. And a lot of times in bigger places, there's always a challenge when you do a hybrid model because people are used to the way the way things are used to be done, right? But in our in our experience, we have seen that there is definitely a greater awareness, a greater amount of institutions and that are using the hybrid model that we offer. So a lot of times the question of students, they said, where do I go to get my clinical hours? So what we tell them is that, nursing home are great ones because usually they don't have a chaplain there. But definitely they're willing to have someone to go there, especially if you approach an administrator and say, hey, I'm training, I'm getting certified. I have a master's of divinity, and you're already a professional, and I'm trying to get a certification, and I think that's a win-win, right? Mentioned a while ago, Medicare, no, not Medicare, but hospice. By Medicare requirement, hospice are mandated by Medicare to have volunteer manpower. At least I think, if I'm not mistaken, 10% manpower should be by volunteers. And we have a lot of of hospice places that are utilizing chaplains as volunteers as part of meeting that requirement that Medicare requires. Um, uh, hospitals that are small, that don't have any, that have part-time or one a chaplain. Can you imagine? If you have I mean, we've had people that we have hospitals that have 300 bed and have a part-time chaplain, and so that and of course chaplain are always looked upon. They don't bring the money, so I said, so here's an idea. You know, if you bring the CPE program there, you just multiplied yourself. You know, can you imagine CPE students are in your facility 25 hours a week? You know, that equates to what? Four would be 100, five would be 125, and then your chaplain that's being employed will be following them, making sure that they don't do anything outside the protocols and things like that. It's a win-win. You know, they're getting expanded spiritual coverage, and at the same time developing a pool of part-time or PRN chaplains, and hopefully as they grow, they'll have a pool of qualified trained chaplains. So those are just some of the low hanging fruit that can be really potentially your clinical site. We have what's this? We have a student that her passion was at a pregnancy center. So she did her clinical hours in the pregnancy center, the men's shelter, the women's shelter. Um, if we follow, what's this? Boyson, it says, right? It's a living human document. Context really is, it's relevant. It's the person in front of you. That's why chaplaincy is growing not only in corrections and in corporate, and more and more now, chaplains in the nursing home, which is something that's really exciting because I've never seen that before.
Hmm. The next question I had, and I guess Chaplain Pollet can help me more with this, so is hybrid CPE a real possibility? And it sounds like from what the other two chaplains have said already that it is, but I'm wondering, you being here in Puerto Rico, knowing the players here in Puerto Rico, for lack of a better term, is hybrid CPE a reality here in Puerto Rico?
Yes and no. So this is the caveat. Unfortunately, if ACPE does come to the training center, it's going to be specifically for a specific religion, which would be Seventh-day Adventist. It would not be outside. So the CPE will be through CPSP will be for everybody. But the ACPE might just be and this is all in the works. We don't know. I mean, at this point, I'm just saying what has been passed around, rumor mill. But I'm seeing some things going around. I don't know. But if they're going to do something, it's going to be specifically focused on Seventh-day Adventist. So that kind of defeats the purpose, because if other people want to do ACPE, they have to go again in virtual or go back to the States and do their studying there. So that is basically, this is where I'm saying that I wish, there will be more schools available, more training centers, not schools, training centers that will appeal to those who need it and who want it, and be diverse. But that is just a dream.
Yeah, so I can't speak to that because I don't know anything about that situation. But if you go on acpe.edu, there are distance learning opportunities where you could do ACPE in Puerto Rico. I'll put my friend I'll put hers in the chat. I think hers is very good. I'm biased, but she, like I said, she has students from around the world. And regarding Seventh-day Adventists only, I will say, because I do know ACPE accreditation, that wouldn't fly in terms of accreditation. So that may not actually wind up working out because
I don't think so either,
yeah,
because I don't know.
and our accreditation program
Inclusive.
is robust in terms of
Mhm.
everything that needs to be in place, and I think that is maybe one of the differences between, I don't know, I know it's a difference between CPSP. It may also be a difference with ICPT, where the accreditation doesn't rest with the individual as the educator or as the certified as the supervisor. The accreditation is really based on the program. And so there's a lot more hoops to jump through and to make it really open to everyone.
And thank you for sharing that. Yes, and so therefore but I'm living in an island, so I'm kind of like, look, I lived very close to Missouri, show me state, that I can like, okay, when you're ready, I would like to see what this all entails. For me, virtual is the way to go. I had to come and live here in Puerto Rico, and they, of course, they offered me the position of chaplain to come here and then also train, and that's how I'm going into board certification. But there needs to be more. There needs to be more, and you know the information that you're going to send. I hope that you're going to send it to everyone because I would
Here,
love
just put it in the chat. But my
Perfect.
caveat is that the virtual CPE does tend to be a lot more expensive than like my program. We charge $100 and we don't charge the residents anything. That's just for the interns, and that's really just so that they show up because when we weren't charging anything, nobody showed up because
Exactly.
the hospital is using the labor essentially of the students so significantly, but for a distance learning, that same benefit to the institution isn't there. And so the individual students are having to essentially pay the salary of the educator as well as the ACPE fees for registering the unit, which are also a decent amount of money.
Yeah, I think sometimes when you think about education, right, we are used to the traditional that says, well, it has to be one way or the effectivity of it is not. And one thing I've learned is that, what may be good for us, that might not be what's good for the market. Definitely the things that are effective for me are not that mean very much to my children that are my grown children because they live in a different time. So hybrid, when we start doing hybrid that was this CPE, there's definitely a lot of pushback on it because as I said, it takes away from the person to person. And they do, it has an element of that, but at the same time, there's also an element of intentionality when you are doing was this when they're doing you're doing it was this the virtual CPE. It's white paper has shown us how just as effective in person or virtual. It's just the way you do it. In our case, we all the groups are recorded and that and it's there for review for the students and also for our accreditors to make sure that we're doing exactly what we say we are doing. So yeah, and yeah, the advantage of being in person is that in some places that we have residency, they get stipend, because they do provide a service, and it saves them from hiring a full-time, several full-time chaplains, especially if you're a huge hospital system. Yeah, so yeah, those are, I think that's the big difference. I think you got that right. The big difference is cost because virtually, what's the advantage of that? Some hospitals that we have worked with have given their students a break, so they do a discount. They pay a certain amount towards the cost to kind of help that cost down. But yeah, so it varies from place to place.
I think at least from my vantage point, the benefit of doing an APCE CPE experience is that you are developing relationships among your peers that you see frequently from week to week, but with the hospital staff and with the patients. And having done a great deal of distance education, I don't see the same levels of relationships being formed with my peers that are in my same educational programs. We're in the program together, the DMin program, but half the time I don't even know what my peers look like in a distance education
Yeah,
program.
and it's a mixed review, right? It's a mixed response because I'm a product of paper and pencil, right? I like those. I don't like iPhone. I don't like electronics. but when we meet with people where they are, they're not they're not like us. What may be meaningful to me may not be meaningful to them. So it's
Exactly.
not for everybody. It's not for everybody. But there are those. I mean, we have an annual conference that we go to for that we encourage our CPE educators and students to go to, and the amount of the level of the depth of their relationship is staggering. It's for me. I was like, wow. I'm old school myself, but I see how powerful it is for them. You know, and I used to laugh because I get mad at my kids because they used to play a lot with online, right? And then it says, no, you got to be in person. But for them, Dad, I meet with my friend every day. Says, how many times do you meet with your friend? Once a week? With other people. So, I think there needs to be a paradigm shift. I think, especially in the day and age that we have. And if it's, for me, being an old man, I think I would prefer the old way. But it would be a miss if I would say, well, it will not work. It's not effective because it's not the way I do it, or I did it. So, anyways.
So having had
That's
this
all.
discussion about hybrid versus center CPE, the question that I have is the quality of the education from the didactic portion of CPE the same in hybrid as it is in residential?
Well, in our case, yes, because it's standardized. They have a curriculum. Whether you are in residence or whether you are doing hybrid, that curriculum is the same thing that you have to go through, and you have to pass it. There's a test on the content of that curriculum, and you have to pass it on top of the action reflection process that we're used to in the that's very bread and butter of clinical pastoral education. uh, uh, and for me, you know, in my mind, because when I took my CPE, I did CPE here, CPE there, CPE there, and if I have a great CPE supervisor, great, but sometimes you don't. But with the standardized curriculum, they can do the minimum and do the standard, but definitely they can enhance it, because the expectation is you will enhance it and make it even better as an educator. That's the expectation. If you do the minimum in our system, then you probably shouldn't be doing it anymore, you know. And besides, there's different settings, different contexts, that necessitates an additional, didactic that would cater to that.
Well, I want to thank each and every one of you. We kind of spent some really quality time together, and we're kind of getting up against my time allotment. You guys have answered a lot of the questions, almost all of the questions in the process of our discussion. So I'd like to terminate. I'm going to take some of the time. We only have one person that is in the audience. I don't know if they have any questions. I'm going to ask if they do in a minute. But before I do that, I want to go around round robin and ask each one of you. So where do you see CPE going, and how has it that it's become so important in the development of chaplains over the years? And I'd like to start with Chaplain Davies, if I can.
Sure. So while we were chatting, I also put a link to an article I wrote about why chaplaincy is so essential. So in case that's helpful for anyone to review. So I think where I see CPE going is really getting more widespread, especially as it relates to other disciplines. So for instance, I lecture at our medical school, and our medical students can now take a elective in spiritual care that involves some of what it involves is shadowing some of our chaplains, doing visits with them. We also offer the same option to some of our Masters of Genetic Counseling students. And so I think the more that we can help people prepare to be spiritual care generalists that are already within healthcare, that's really important. And then the chaplains will continue to be the specialists who are the ones, doing that really targeted spiritual care intervention and skill. I just think certainly the relationships that we have with various graduate institutions is really key, as well as denominationally. Some people have CPE requirements in order to get ordained. Some people send people to CPE instead of sending them to therapy, knowing that they have to sort out issues before we release them to a congregational service. So as there's more and more tent making happening in terms of bivocation within a lot of ministry that I see, at least within the Christian ministry fields, I do think that we will see a lot more people using the CPE skills, maybe in some of those traditional ministry senses, but I also think where we'll see CPE go is using CPE in unexpected places.
Yes.
So I've had, I had a student recently who was a professor who wanted to, be able to connect better with his students. And so he was still going to maintain his job as a professor, but did CPE in order to grow kind of in that interpersonal relationship and communication style. So I think if we can really help the public know what CPE is, because just as chaplaincy has a marketing problem, CPE even more so. And so really getting people to see the benefit.
I agree. I totally agree. As a matter of fact, one of the growing segment in our program is CPE to nurses. A lot of white paper has been done where there's a hunger for, or there's a need for medical practitioner and nurses who are always in contact with their patient. To pick those kind of skills. So we have a growing segment wherein nurses are taking CPE as part of their training.
Chaplain Pollet, where do you see it going here in Puerto Rico?
Well, I'm actually writing to the governor. So I'm writing to the governor regarding having some lines of demarcation so that we know what is a professional chaplain, and also regulations on others because of the previous governor. The other thing that I see in Puerto Rico is that the more, and I don't like to use expats because they're not expatriates. We're still a part of America. We're Americans. So, but I see an influx of Americans coming from the mainland to the island, and we're going to need to have more chaplains, bilingual. And so I'm getting a new director at the hospital, and I'm proposing this plan and letting them know we need to have we need to raise the bar and have the gold standard, because of the fact that there are so many things that are happening in chaplaincy that not necessarily involves clinical pastoral chaplains, but that of lay pastors or lay evangelists or lay chaplains. So I do see a change. I see a movement, but I believe we have to go straight to the top. And I know that we have issues with the governor. She is a pickle, but we know we're gonna go ahead and tackle that as much as possible and see. And the hospital is willing to grow and willing to, if they don't know, they're not going to grow. And so I tell them all the time, you have to be involved. Wherever we can be involved. There's a presence. I'm going to talk to the marketing director, Joshua, And I have a little video that I think you should put in the website, because when I've gone to the rooms and I say hi, I'm the chaplain, oh my God, I'm going to die. And I'm like, no, you're not going to die today that I know of. But let me tell you something. I'm just going from room to room and floor to floor, and we're here to support you. And there's that myth that only chaplains come to a room and when you're going to die or when they're going to give you bad news, which that's part of the, part of it. But we need to educate. And I think it's all about education and marketing. And I know that CPE, CPSP hasn't really, they don't want to do marketing, but something has to give. And so we need to be, the squeaky wheel gets the job done. So be the squeaky wheel, and let's see what happens with the governor.
Let me say this. I've been to Puerto Rico, and I am Puerto Rican, by the way. And I've been here in Puerto Rico for the last 3 years. And it always interests me. When I was in Cebu, I don't know if I'm mispronouncing that, Chaplain, help me
You
if I
said it
am.
right.
But when I was there, most of the people from the lowest echelon of the economics to the highest level of economics spoke wonderful English. It was amazing. And for a place like Puerto Rico, which is so much closer to the mainland than PI, and by the way, PI is not a territory, PI is a country, but it spent a lot of years as a territory before it became a country. The fact that Spanish is so predominant here in Puerto Rico, it's amazing to me. And being an import into Puerto Rico, I'm concerned about my ability to be a chaplain because of the language barrier. But, I think, I don't understand why there's so much. Some people claim to be American. Some people say, I'm not American. I'm a Puerto Rican with an American passport.
Resistance is futile.
There's a lot of that going on. But I think that has an impact on CPE.
It does have an impact, not just with CPE, but it since we're talking about CPE, yes, it does have an impact. And but there is a resistance, and then that resistance continues. But when you have Rincon and you go to Cabo Rojo, which is the areas where they have predominantly Anglos that come from the mainland, it's the beach area, it's the beautiful area. They too, when they come to our hospitals, they're like, "Oh, you speak English? Oh my God, come and see me every single day." And I get to see them every single day. And one thing about my hospital, our hospital do follow-up as chaplains. I know it's unheard of, but we do follow-ups on and so I have over 1,000 names on my cell phone, because these people, I've built a relationship, professional relationship with them. So when they come to the hospital, it's like, where's Chaplain Grace? And so of course, I have to train other chaplains that be careful that they don't imprint and then they only see you as the only main source, because that's a big mistake, and that's room for a lot of burnout. So it's all about being balanced. But yeah, you're right. For you, either you learn how to speak Spanish, or you're gonna have to go to Cabo Rojo and Rincon area or San Juan. So
or Bayamon.
Oh, Bayamon.
Yeah. Let me I kind of took, first of all, I wanted to thank each one of you. We are up against our time, but before we go, and I appreciate your time, there was one member of the audience, and at this point, I'm just going to go ahead and let her come in. I don't know if she has anything that she wants to share or ask. But she's been faithful, and she's been with us the entire 2 hours. So let me see if I can get her on. Nope, it's not unmuting. And I don't know if she put a message in the chat, but I want to thank you for hanging in there with us. I know we talked a long time, and we talked about some important subjects, some very important subjects for the care of our people, both spiritually emotionally and medically. I want to thank each one of you, Chaplain Davies, Chaplain Cuenca, Chaplain Pollet. As a doctoral student at Liberty, they're training us to be chaplains, even though a good number of us have already been chaplains for a while. It's the academia that's a little bit different that we haven't had. And you guys have made a significant impact on the academia of this student. I want to thank you. I appreciate your time. I appreciate your willingness to be here. You will be hearing from me in a little while after I have some things I want to share with you. Time is money, and your time is very valuable, and I want to appreciate that and do respect to the time that you shared with us. So thank you. We're going to end a little bit earlier. It's 8:42. We were scheduled to go to 9 o'clock. Do any of you have anything that you would like to share with us before we go?
It was a pleasure meeting everyone, and I want to know if I can do follow-ups with every individuals, because there's some questions, and if you have any questions for me, I would be more than happy to provide. And my family from the Philippines, okay? Thank you. So I do have family in the Philippines. So just know that I'm here to give support, and it was very informative, and it gave me a lot of ideas in my head to how to formulate to write to the governor. So.
All right. Well, thanks for having us, and it was a pleasure to spend this time with you all. So I think that's all I have.
Yep.
Thank
Happy
you,
to
sir.
talk about CPE and chaplaincy. It's my favorite subject. So thank you.
All right.
Good night, all. Thank you.
Bye-bye.
Okay, bye-bye.